Is he here yet?
He's on his way. I've got to take a leak.
That's the third time this morning.
Yeah.
Hello! Oh, how are you, mate? How you doing, all right?
Pretty well.
Good to see you. So, this is the beast, eh?
This is her.
Oh, well.
A few issues, but...
Let's pop the bonnet and have a look, see what's under there.
Yeah.
So, where's the problem?
Over there.
What, here?
Yeah, it might be down there. Not quite sure exactly.
You sure?
No, well, you know, it's down low, yeah.
Mate, you're going to have to come and show me.
Yeah, all right.
You all right?
Yeah, I'm fine, yeah.
You're walking a bit funny.
Well, it's been... Look, I've got this problem. See?
The old leaky doodle, eh?
Yeah, I went to the toilet and shook it and put it away, and then this happens, you know?
Yeah. You got prostate problems, eh?
I wasn't lying down or anything. I'm just standing up.
But not prostrate, you clown. Prostate. It's that little walnut between your bladder and your dick. How long's this been going on?
Oh, yeah, it's been getting worse. It's a fair while.
So, no more standing back and shooting at the urinal wall in the pub, eh?
Oh, more like just standing up and hoping it falls out into the right spot. It's not exactly powerful.
Yeah, no fun that. How old are you now?
I'm 62.
Well, you know, it's normal for blokes your age to have some sort of a prostate problem. It's a bit like this waistline, you know, it expands as you get older.
I mean, it's going to get worse.
Well, it's a bit like the problem on this car. It really depends on what you do about it. I'll give you some advice about that while we're working on this, eh?
Oh, okay. Yeah, good idea. Okay, well, I've sort of looked online a bit, and it's a real witch's brew of stuff about prostate cancer. And
Oh, you don't want to go there. Dr. Google won't be your friend with this one. You can't get a cure for something until you know what it is that you're trying to fix. See, just because you've got an enlarged prostate doesn't mean that you've got cancer, but you won't know until you get a test.
well, is that finger up to date? No, I don't want that.
No. You wouldn't learn much more from that than the fact that you've got an enlarged prostate, and you already know that. What you have to do is get a blood test and see what's going on with your PSA.
PSA? What's
Yeah.
that one?
Prostate-specific antigen is the markers in your bloodstream that tells you what's going on inside your prostate.
So then what? Chemo? Radiation? Surgery?
No. Yeah, none of that. You don't get a diagnosis from a single test. You go and have a couple of tests over time, and they check out what the markers are doing. It's the trend that's important. And if it's going upwards, you've got to go and have more tests.
So that's when the doctor puts the finger up the sphincter.
No. You need a much more educated finger than your average GP anyway. The doctor will refer you off to a urologist, and they'll talk to you about what your options are for further investigation. Just remember, you have some say about what sort of investigations they do.
So how do I know what to believe?
Well-
I can't argue with a medical specialist.
Yeah, you can. You just get yourself educated. Dr. Google won't help you, but there is a website that's got some real information. It's the Prostate Cancer Foundation of Australia, PCFA.
And so what, that means I've got cancer?
Easy, Tiger, don't get ahead of yourself. The stuff on the PCFA website will cover all the information you need to know about prostate issues, including when you don't need treatment for cancer. But what you can't do is just ignore the whole thing and hope it goes away. That's how blokes die. The main reason for schooling yourself up before you see a specialist is because the technology's changing all the time. the tests that were standard practice not long ago have all been superseded, and now they're much better at identifying what needs treatment and what you can leave alone. Besides, having a swollen prostate doesn't mean that you've got cancer. It might mean that you're just looking for a treatment to make it easier for you to go and have a leak.
So, no digit up the chocolate starfish then?
You really got a thing about your ass, haven't you? Like I said, the urologist has a much more experienced finger than a GP, but that's not going to tell you whether or not you've got cancer. There's much better tests to do that job.
So I let the specialists do their test, but then how do I know what to trust in the info?
Well, you know that Prostate Cancer Foundation I was talking about? On top of the website, they employ full-time specialist nurses you can talk to face-to-face, and they'll give you some objective information about what your options actually are. They talk to you about the results of your tests and the sort of treatments that are likely to work for you.
Yeah, well, that's good because I'm not real flash on the internet and I prefer just to talk to someone face-to-face.
If you do, there's a couple of places you can go, but for technical information, your best bet is the PCFA nurse.
I'm a prostate cancer specialist nurse and I'm funded by the Prostate Cancer Foundation of Australia. A specialist cancer nurse provides expert information and evidence-based support for men that are diagnosed with prostate cancer and for their loved ones. So I give clear and consistent evidence-based information about their diagnosis of prostate cancer, what their treatment options are, and help them with their decision making and side effects maybe that they might be experiencing from their treatment, and provide emotional and practical support, not just for the patient but also for their loved ones. And also refer them on to local supports like the Prostate Cancer Support Group or the PCFA telenursing.
The support group? What? You know what I mean, sitting around holding each other's bollocks singing Kumbaya there?
No, look, it's just a place where you can go to talk to other fellas who've been on the same journey as you. You can find the nearest one on the Prostate Cancer Foundation website, and they look a bit like this.
It's basically sharing experiences. The support group can actually provide experiences from understanding side effects of their treatment that then can be talked about, and others who are undergoing similar problems can learn from the experiences of the others.
I would suggest that they become familiar with what the PSA is and to become familiar with that figure. And so that next time you have one, keep an eye out for that rate of increase. That would be my advice, and get onto it early.
As you know, you got 20 people and there might be 15 different situations in there. There's a fair chance that somebody's similar to somebody there, so they get a lot of information.
Of course, up on the tablelands, you might not find a support group like that. And if that's the case, then all that stuff that's on the PCFA website, the stuff they've got online, can really be a lot of help.
Men and their loved ones can go to the Prostate Cancer Foundation of Australia website and they can find there a toolkit that will help them with their decision making, provide evidence-based information. There's also a telenursing and counselling service that's really important, particularly for men who may live in more rural and remote areas or may not have access to those services.
The trouble with Dr. Google, or Barry down the pub, is that everyone's journey is a little bit different, and you're going to get the weird and the wonderful as well as the stories that are just plain made up. You're much better off to get straight answers from somebody who actually knows.
Common questions are around uncertainty about the future. What does their diagnosis mean? What's their histology mean? Their staging scans? Will I die? They're the sort of common things. A lot of them have heard other stories, and it's important that you clarify and let people know that this is their journey and each journey is different and each treatment's different. It's unique for them.
And like Margie says, just because it happened a particular way for Barry down the pub doesn't mean that's how it's going to be for you.
So I don't need the finger up the bum.
Correct. And with the change in technology, you soon won't need intrusive tests like biopsies either. We're talking about the most commonly diagnosed cancer amongst blokes in Australia. There's over 250,000 Aussie blokes who've been diagnosed with prostate cancer since 1982 who are still alive and with us today. So provided you get early diagnosis and treatment, your odds are really good.
Oh, how did you go? Did he diagnose the issue?
Yes, just not the one I was thinking of.
Oh, okay. What was his name?
I got his card here. Dick Trouble.